My name is Mercedes Navarro and I work in genetic diagnosis, an activity that I combine with genetic research. More than 7 years ago, I started a professional freelance project in genetic counseling called Genifen. All this journey led me to do my doctoral thesis in genetic counseling. I present this work as a small sample of my doctoral thesis analysis. This research has been developed within the Rare Diseases Research Group of the Institute of Health and Biomedical Research ISABIAL in Alicante, Spain, thanks to the Rare Disease consultation at the Dr. Balmis Hospital in Alicante. The focus of this presentation is analysis the degree of empowerment and health decision-making actions of two groups of Fabry patients, Fabry carriers belonging to a patient association that is not clinical environment, and the patient of clinical environment. All this through the genetic counseling outcome scale in order to evaluate whether genetic counseling interventions improve patients' attitudes towards possible decision making, especially at the clinical level, for example, as a family member becoming involved in a genetic screening. The analysis of the answer reflects that the controlled patients showed significant greater empowerment in the decision domain and cognitive domain. These results are important for our Fabry community patients. Although Fabry is a rare disease, there is a large community, a large prevalence of Fabry patients or care carriers at the rare disease consultation of the Dr. Balmis Hospital in Alicante. All that results may indicate a greater motivation to participate in family screening, detection of new GLA carriers from participation, and family screening allows patients to be followed up medically and allowing access to early medication and clinical treatment, especially for a symptomatic Fabry woman. In this context, personalized genetic counseling interventions are a key point for patients to make informed decisions in order to facilitate clinical screening participation and non-clinical decisions, for example, reproductive planning. While this may seem obvious, converting actions into numbers or figures helps to demonstrate implementation for the benefit of patients to hospital managers, facilitating the incorporation of genetic counseling into health and social benefit policies. In this sense, being able to have numerical markers for genetic counseling will help in this regard. Thank you for your interest.